This week on Healthy Living, we take a look at a silent crisis affecting millions across the globe, loneliness. We'll see the impact of social isolation on our physical and mental health. And Gillian Rakusin, Executive Director of the Foundation for Social Connection, shares some tips to address loneliness. Plus, Kenya's electronic health system is transforming rural healthcare access. That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another episode of Healthy Living. Loneliness is on the rise, and it's not just a personal issue. Recent studies indicate that an increasing number of people are experiencing feelings of isolation and disconnection, and this is becoming a public health concern. According to the World Health Organization, an estimated 1 in 4 older people experience social isolation, and between 5 and 15% of young people experience loneliness globally. People experience loneliness regardless of age, gender, and socio-economic boundaries. Medical experts say the issue has a serious impact on physical and mental health, quality of life, and longevity. They say factors such as urbanization, the rise of digital communication, and the effects of the global pandemic have all contributed to a surge in people feeling isolated and disconnected. WHO is making loneliness a global health priority with the launch of a new commission on social connection to address the pressing health threats of what the organization say is a global epidemic. Let's go to Casablanca in Morocco, where VOA's correspondent Emmanuel Mouadjidibé and Emmanuel Ngapela spoke to psychologists about the challenges of loneliness.
Isolation or loneliness is the absence of social interaction caused by physical illness, mental disorders, or social problems. When isolation is due to physical illness, it's called forced isolation, which is usually done to prevent the patient from contaminating others. It can also be due to mobility problems, as some patients may suffer from illnesses that make them dependent on others. There are also people whose isolation is due to mental disorders.
If it's caused by a mental disorder, as a psychologist, we work with the disorder. If the isolation is caused by an anxiety disorder, we work with the patient on the anxiety disorder. Different methods can be used, such as the cognitive behavioral therapy. If it's caused by depression, we work with the depression. So when the therapist works with the disorder with the patient, we can notice a suppression of the symptom.
In younger people, isolation may be due to harassment and intimidation outside the family environment and to certain parental behaviors or neglect at home. Isolation may develop in those who are overexposed to computer, tablet, or smartphone screens. This translates into a lack of direct interaction in favor of virtual relationships and interactions on social networks.
We need to involve young people, often create opportunities for social interaction, foster inclusion, and also reinforce social skills, group activities. We need to integrate them into clubs, community initiatives, and emotional support. That can help integrate young people into their environment.
The elderly are also vulnerable to isolation.
The elderly need to be encouraged to set up discussion groups, and even their children need to find time for them, because in our culture it's inconceivable to put them in the retirement homes. So above all, we need to work on awareness and education.
According to health specialists, since the COVID pandemic, telecommuting has also become a widespread reason for isolation.
What circumstances make you feel lonely, and how do you cope with loneliness? Here are some reactions from Addis Ababa, Ethiopia.
The feeling of loneliness arises from different reasons. You will face different things in life. Sometimes there are things you can't say. There may be friends, but you may also feel lonely during such times.
There could be many incidents that will make you feel lonely. For instance, when you need something and couldn't get it, you might end up saying, had I have this person in my life, I could have gotten it.
I had experience of feeling lonely. I went to church and dealt with it spiritually, but I also feel like this could be resolved by meeting other people. Meeting with family members, friends, and people will make you feel better.
When I feel lonely, I spend time with my friends, but if I can't do that, I'll go to church and pray. And while I am lonely, I think about how to resolve this feeling and how to feel grateful for what God has granted me. I'll try to meditate on what is given to me. It's more than what I asked for. That way, I'll erase the feeling of loneliness.
Gillian Rakusin is the Executive Director of the Foundation for Social Connection. She tells us more about loneliness and how to address it.
So social isolation and loneliness in a chronic state can be really detrimental to our mental and physical well-being. We've seen that chronic isolation can lead to increased risks of heart disease, dementia and Alzheimer's, anxiety, depression, diabetes, and other related health conditions. We also know that it can lead to, it increases our risk for premature death by 26%, which is really startling when you start to think about those numbers. And we also know that on the opposite side, high quality social connection can protect us from these conditions. And also it can boost our survival by 50%. We've seen, especially through the pandemic, but even before, that anyone can experience these types of conditions. So we see right now that actually Gen Z, ages 9 to 19, are experiencing social isolation and loneliness at a really high rate, as well as millennials and other young adults. But we also understand that individuals who are new moms, who are veterans, those that are experiencing disabilities, LGBTQ plus population, BIPOC populations, other historically marginalized groups of people who feel like they maybe don't belong or have a place that accepts them. So we know for individual and interpersonal relationships, things like for the individual, meditation, gratitude, reflection, cognitive behavioral therapy, other types of some of those individual interventions can be very helpful. We also know with interpersonal connection, things like, friendly caller, friendly visitor, or volunteering, things like that put somebody out into the community and meeting others can be a really great way to start to intervene in those feelings of isolation or loneliness. And then when we start to think about community supports and community interventions, those can be things like, support groups in the community, but also thinking about the structures and infrastructure of that community that supports connection. So are there sidewalks? Are there places for people to gather in the community, like a community center, where people feel safe and people feel like they're included? Are there parks, libraries, other sort of access points where people can create opportunities to be together?
Kenya's health ministry has rolled out a digital health information system to help workers diagnose patients and store their health records. Mohammed Yusuf reports from a village in western Kenya where hospitals have recorded an increase in people seeking medical assistance since the deployment of the system.
Mildred Owegi is one of 3,000 community health promoters in Kisumu County in western Kenya. Owegi, who has been doing this work for 30 years, recently started using a digital health information system on the job. A phone app allows her to diagnose diseases before administering medication and to know when to advise people to visit a health facility.
Because normally we are using these handouts. We are just using handouts. And the phone is good because the phone is directing you on what to do. So you can do what the phone is telling you. So you can do the right thing.
Lillian Okello, a mother of twins, is embracing the new system.
I like the digital way of taking the health data of the children because when they always come, I always see them just reading what is in the phone and doing exactly what they're supposed to do compared to the manual one.
Kenya launched the Digital Health Information System last month, providing smartphones to 100,000 health workers nationwide with the goal of improving the quality of healthcare. Health experts say the system could push Kenya closer to universal health coverage, ensuring people can access healthcare services anytime and anywhere. In the past few weeks, in this hospital in Kisumu County, the number of patients seeking medical services has increased from 700 to 1,800.
The number of patients has increased a lot. More so, again, the guys who have achieved a lot in terms of the digitalization of HIV clans and TB clans, because we can detect them early, we call them a day before, and they come.
The local government says the deployment of electronic system allows it to plan for the healthcare needs of the people.
So we don't have to look for data because it is within a touch, and we can use it to make a project what we might have. For example, we can say that next year we're expecting this number of the deliveries. Next year, this year we expect to consume this amount of commodities. This year, these are our baseline mobility levels. So we expect next year we need to prepare for a similar or something higher or lesser.
The project still faces hurdles such as the lack of reliable data networks in some areas. For now, health workers are advised to seek places with good connectivity when helping people in need.
When his personal life was touched by autism, Jonathan Trichter made a career change and co-founded Foundry Learning Center. The center is an alternative education day program serving students with autism and other developmental disabilities. Jonathan also launched the Autism Transit project, where autistic kids write and record subway announcements to be played as part of Autism Awareness Month.
When you're around kids with autism, you're familiar with this phenomenon where they perseverate, which is a fancy word for focusing intensely on things that neurotypical people find asocial. And this can often be feats of mechanical engineering that we encounter every day. This is especially true of mass transit and trains. And so that, combined with the fact that these same children don't come to language naturally like neurotypical children do, they will grasp onto phrases that they hear in places where they're focused. And as a result, it's not unusual for the first full sentence that a child utters to be something they hear in a train station. In New York, it might be "stand clear of the closing doors." From there, it was not a great leap for me during Autism Awareness Month to ask the MTA last year if they'd allow these kids to record their own versions of the announcements they hear. And to their credit, the MTA agreed. That made a bit of news. We then went out larger to other mass transit agencies in large urban areas.
If you see someone at risk of falling onto the tracks, please get help immediately. Tell a police officer or an MTA employee. Be safe and happy Autism Awareness Month. When Jonathan made the project started last year, I was so into it. I was ready.
Hi, my name is Elliot. I am 11 years old. Thank you, MTA, for letting me use my assistive communication device to make an announcement during Autism Awareness Month. The MTA works hard to keep our stations and tracks clean. You can help too. Thank you for riding with MTA New York City Transit.
He's very proud of his own voice.
I think it's exciting for Raphael to be able to share his love of trains with others. For him, it's not just a way of getting from place to place, but he enjoys the planning, finding out the timing of the trains, and kind of estimating the models.
I want them to learn how to read, write, and be autonomous. I want them to have a career path. I want them to love. I want them to be loved. And I want them to be part of the human experience and feel confident participating in it.
Yeah. Thanks for watching Healthy Living. For the latest news and coverage, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linor Mudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.